friends, welcome to another session in the Shruthi Nursing Officer channel, that is the repeated abortions. Okay, in the previous video we discussed about the abortions, right? So here today we are going to discuss the repeated abortion. Okay, the name only suggests what is the repeated abortion. It is a repeatedly the woman is going to suffer feel with the recurrent pregnancy loss. Okay, recurrent pregnancy loss, the another name for repeated abortion is the recurrent pregnancy loss. Okay, so here at how many times if the mother went on with the abortions are mainly 3. Okay, 3 consecutive pregnancy losses is called as the repeated abortion. Okay, so repeated abortion is also called as recurrent pregnancy loss or the habitual abortion. Okay, here what happens, habitual means the uterus in the uterus the abortion is become the habit. Okay, so only it is called as habitual abortion. Okay, then what is the definition of the repeated abortion? When there is a 3 consecutive pregnancy loss prior to the 20 weeks of pregnancy. Okay, here in the 20 weeks, within the 20 weeks the 3 consecutive pregnancy losses will be there, which can lead to the repeated abortion, is called as a repeated abortion. Then what are the causes or the etiology are the mainly the genetic causes. Okay, here mainly the 2 to 4% of repeated pregnancy losses are because of the genetic factors. These genetic factors here, the genes or the chromosomes which are transmitted from mother and father, mainly those are the genes and chromosome helps in the development of the all over growth and development of the baby. Okay, if any abnormalities in the chromosomal structure, it can lead to the repeated abortion. Okay, so this is the one, that is the first cause of repeated abortion. What are those? Genetic factors. Next one is the anatomical factor. What is the anatomical factor? Here the anatomical factors mainly accounts for 10 to 15% in the repeated abortions. Okay, 10 to 15% accounts for the anatomical repeated abortion, that is the anatomical etiology or the causes. Okay, here what happens, here there will be interruption in the vasculature in the endometrium of the uterus. Okay, for example, if you want to pour water to a plant, if you planted a tree, that plant has to take the proper nutrition, right? From the soil only it will absorb all the nutrients. Like that only what happens, the pregnant woman, when she is pregnant, through the placenta the baby is going to suck the nutrients from mother. Okay, so in order to develop, so how they will suck? From the blood only. Okay, for the blood transportation the vasculature must be very good. Okay, if there is an interruption in the vasculature in the endometrium, which can lead to the repeated abortion. Okay, when there is less vasculation to the endometrium, which leads to the abnormal or the inadequate placenta formation. Okay, if the placenta, one keep in mind that the placenta is a barrier between the mother and the baby. Okay, whatever the nutrients or the respiration or the excretion, everything which is going, which is processing from mother to baby, is the only barrier or the only channel is the placenta. So when there is the improper vasculature, then it leads to the improper development of the placenta. Okay, when placenta is not properly developed, what happens, there will be interruption in the transportation of the nutrients from mother to baby. If the growth of the baby is not at all proper, which can lead to the repeated abortion. Okay, and next one, third one is the congenital congenital uterine anomalies. Okay, congenital uterine anomalies means the women who got these anomalies from birth itself. Okay, those are because of the genetics or the genes which are transmitted from their parents. Okay, so some of the congenital anomalies also uh, plays a very important role in the repeated abortion. Okay, next one is the intrauterine adhesions. Okay, intrauterine adhesions, then intrauterine fibroids or the polyp. Okay, any cancerous, any lumps present in the uterus or the any polyps. Okay, polyps in case of PCOD, like that. Okay, these are accounts for the next etiology of the repeated abortion. Then how we are going to diagnose the intrauterine fibroids or the polyps means, as you know already, the USG. Okay, ultrasonography. In that ultrasonography we are going to see the hysteroscopy. Okay, hystero means the uterus, scopy means visualization. Okay, visualization of the uterus, and as well as the hysterosalpingography. Hysterosalpingo means, hystero means the uterus, salpingo means the fallopian tubes of the uterus. Okay, these all are the diagnostic evaluation in case of intrauterine fibroid or the polyp. Then next cause is the endocrine causes. What is this endocrine? As you know already, the estrogen, progesterone and prolactin. As you know, all these in the we known about this in previous video. Here in case of endocrine, what happens? In case of PCOD, what happens? The progesterone is normally not going to properly regulate from the corpus luteum, so then it causes the repeated pregnancy loss. Okay, the next one is the luteal phase defect. Luteal phase means, as I told you, the ruptured follicle is called as the corpus luteum. This corpus luteum mainly helps in the mainly helps in the production of the progesterone. Okay, temporary gland, as I said you already, it is a temporary gland in a production of the progesterone. Okay, in case of luteal phase defect, what happens? The progesterone is not at all producing, which can leads to the pregnancy loss. Okay, so next one is the diabetes mellitus and the thyroid diseases. Okay, no need to explain more and more about this. Okay, because I already explained in the previous video. And hyperprolactinemia. Okay, increased levels of the prolactin in the mother's blood, which can leads to the repeated abortions. Okay, so why? Because here in case of increased prolactin level, there will be a estrogen level is going to decreased, which leads to the improper ovum formation. Okay, which leads to the repeated abortions. Then approximately 17 to 20% of the repeated pregnancy losses are because of the endocrine causes. Okay, how much account? 17 to 20%. Okay, next fourth one is the infectious causes. What are the infectious causes? Sexually transmitted diseases or the reproductive tract diseases. Okay, next one is the immunologic causes. Okay, here what happens in immunological etiology? Here when the mother is pregnant, her immunity is suppressed. Why? Because the fetus which is growing inside the mother is a foreign body to the mother body itself. Okay, in order to reject the fetus, what happens? Our immunity system is going to decreased. Okay, so in case what happens, immunity is not at all suppressing, then it causes the repeated abortion. Okay, this one is there. Then these all are the causes. Okay, when you know the causes, you can prevent the repeated abortions, right? Then how we will prevent the this one? As I said you in the abortion topic, that is the preventive measures. Okay, what are the? First of all, quit smoking, quit alcohol, and reduce the caffeine intake also. Okay, reduce the caffeine intake. Okay, what happens here? When you take the coffee, which decreases the blood flow to the placenta. Okay, blood flow to the placenta is decreased. Then how much amount of coffee we should take here? Less than 200 milligram per day. Okay, less than 200 milligram, which accounts for 12 ounce cup of coffee you can have daily. Okay, then please comment in the comment box what is the 1 ounce accounts for how much ml. Okay, 12 ounce is equals to dash ml. Okay, this is the homework for you all. Okay, then next one is the first, if she is suffering with the any infections, that should be screened. Okay, like sexually transmitted diseases. Okay, these sexually transmitted diseases are HIV, AIDS, syphilis, like that. Okay, and take folic acid. Okay, vitamin B6, B12. Okay, all these micro and macronutrients are very important for the formation of a fetus. Here what happens, when we used to give a folic acid to each and every woman who are diagnosed early, whether she is pregnant or not. If the UPT is positive, urine pregnancy test is positive, we are going to give the folic acid. Why? Because in the initial first 3 months, what happens, the backbone of the baby is going to develop. Okay, the NT scan we are going to do that. Okay, so if the backbone is not at all properly developed, which can leads to the abortion also. Okay, or will go for the medical abortion. Okay, so first, the main formation of the backbone is all because of the vitamin B12, vitamin B6, which is present in the folic acid. Okay, try to take the folic acid and don't avoid folic acid. Okay, and get tested for the diabetes. Okay, screening for diabetes is also very important. Okay, these are the preventive measures. Then what are the dietary measures we need to take in case of repeated abortion to prevent? Okay, the complex carbohydrates. Complex carbohydrates are these are the main forms of carbohydrates, mainly present in the brown rice. Okay, brown rice is the unpolished rice. Okay, if the rice is polished, we don't have any complex carbohydrates in that. Okay, so the brown rice is very good for health. And the sweet potato, okay, which is naturally sweet, which doesn't have any calories. Okay, so sweet potato, please take the sweet potato. And quinoa, is nothing but the navane hakki, we'll call in the Kannada, navane hakki. Then, as I said you already, please avoid the carbohydrates and fats. Please take excessive intake of proteins and fibers. Then we need to take the proteins and fibers, right? So in case of proteins, what we need to take? Poultry. Poultry is the egg. Okay, main take the egg and low fatted dairy. Okay, milk, cheese, okay, buttermilk. Okay, everything you need to take. Next, the fish is also okay. The only food which is rich in omega 3 are the fish and the seafoods. Okay, try to take, because omega 3 is very important for the development of the baby brain. Okay, omega 3 is also very important. Then healthy fats. Okay, healthy fats. Why healthy fats? In order to increase the weight of the baby. Okay, healthy fats which are the mainly present in the avocado, seeds. Okay, seeds, mainly the sunflower seeds. The so many seeds are available in the market. Try to take those. And the nuts. Okay, nuts also very important. Okay, nuts, groundnuts, walnuts. Okay, avocado, like that you need to take. And fiber rich food. Fiber rich food, which is the richest fiber present, means mainly the green leafy vegetables. Okay, green leafy vegetables also very important. Okay, if the properly folic acid content is not at all taken, what happens? It increases the 47% of risk is because of the miscarriages or because of the folic acid deficiency. See, keep in mind 47%. Okay, it's nearly 50%. Okay, so don't neglect to take the folic acids. Okay, in order to prevent the repeated abortion. Okay, clear with the topic? If there are any doubts, please do comment in the comment box. I will definitely answer for your questions. Okay, so please like the video, share to your family and friends, and please subscribe to my channel Shruthi Nursing Officer. Thank you. Bye bye.